Okay, Z-Pack, I have back with me one of my favorite people in the world, Dr. Dave Persing. He is the Chief Medical Officer of Cepheid and Chief Technology Officer of Cepheid as well, and his personal and professional passion is flu. Welcome back, Dave, to the show.
Thank you. It's
Man,
a pleasure to be here.
We had a great conversation before about all the nature of PCR and how you grew it and all that, and we touched on flu. And we worked actually with your company making that video, This Flu Test is Killing Me, about flu testing. And that's when I got more interested in this intersection of deep science and management of flu.
Yeah.
Well, it turns out it's something you're really crazy about.
Yeah, absolutely. You know, flu testing has been a big challenge over the years because of the fact that a lot of the technologies in use a decade ago just weren't as reliable as they needed to be. You could generally trust a positive result, but you really couldn't trust a negative result.
So it was very specific, but not sensitive.
That's right.
Did I do that right?
You did that absolutely right. So the positive predictive value was better than the negative predictive value of the test. So we endeavored to change that with a flu cartridge that we developed a few years ago. And we were very successful with that. But during the course of a few seasons, we were seeing where some of the molecular tests that were developed were losing their ability to detect the strains that were occurring during the course of the season because of a mutation that happened in the target gene that was being amplified.
So in other words, as we all many people know, the flu is constantly modulating, mutating, changing, and that was befuddling the test, the molecular level test.
Yeah, even the molecular tests were getting befuddled.
So looking at DNA or RNA in this case.
We didn't want to go back to the way things were with the antigen tests, so we ended up completely redesigning our flu cartridge to include not one genetic target, but 3 independent genetic targets that were highly complementary, that compensated if one of them developed a mutation. So the other 2 would still function. And we also said, we really need to prepare for the worst with this technology. We need to build in the ability to detect avian flu strains. If the worst happens,
the so-called bird flu.
Bird flu. If the bird flu, which is what happened in 1918, was a highly reassorted virus that included bird flu segments.
How many people died? Something like 20 million?
Estimated up to 100 million people died as a function of that. And probably a bigger impact than World War I in terms of overall worldwide mortality. But it was it would have been a huge problem for any flu test to be able to pick that infection up. And so we built in an avian target, an avian preferential target in the assay as well. And the idea was to make it bulletproof, that it wouldn't be subject to seasonal drift and antigenic variation, mutational variation, so you could rely on it year over year.
And then that drift and that antigenic variation is what makes flu so difficult to sort of become immune to or generate vaccinations for, because it's always changing and the target, the antigen targets are changing.
Yeah, exactly.
Right. So testing is still a problem, so it's also a problem for testing.
It's also a problem for testing.
Why is flu so evil? What is it doing to us?
It's just the nature of an RNA virus. It mutates quickly, it's very adaptable, it has a very plastic genome that accommodates a lot of changes over time, and it's just part of its adaptability across species and within a species.
Is it because error correction within RNA is less robust?
It's likely that there's immune selective pressure happening in the population that's infected, so that you get these immune escape variants that are mutational variants that are difficult to detect. The vaccines have been are typically assembled based on what's expected to happen in the upcoming 18 months. Usually they're right. Sometimes they're not right in terms of the mix of strains in the vaccine. Overall, the vaccines have been highly effective. Recent paper in the New England Journal saying that actually Influenza has a huge impact on cardiac morbidity and mortality because of the fact that it produces this highly inflammatory state and may actually infect the myocardium. And this is really important stuff.
Yeah, let me put an emphasis on that. So this data showing that people infected with flu are more likely to have heart attacks, more or less, to simplify it, because of the reasons that you said. This is yet another reason that flu can be very dangerous, and why getting vaccination right is important. So sorry to interrupt.
Yeah, that's absolutely right. Vaccination is still our best strategy for preventing flu. Even if the vaccine's not fully protective in blocking the infection completely, it still has an effect on reducing the severity of symptoms, and that's going to have an effect on morbidity and mortality. So, but even if a case does come into the hospital that's infected, it's important, to be able to identify the case quickly, to institute antiviral therapy if they're going to be admitted to the ICU to prevent complications downstream, and try to block transmission within the hospital setting by getting them on antivirals quickly. And this is a very important strategy that fast testing enables to happen.
Can I ask a question? So in terms of predicting the composition of next year's vaccine, would extensive molecular testing like what you guys do and offer on a mass level with data that fed back into CDC, would that help us design better vaccines?
It could. I think one of the hard things to do is predict when the flu season actually starts. Right now, samples get sent to state public health labs, local and state public health labs, and then CDC. And there's about a 2-week delay in assembling all that data. Wouldn't it be nice to be able to pull data directly off the instruments as they're testing patients in real time in emergency departments and hospitals, and feed that into a cloud-based system to actually look at the breakdown of results? Is it flu A? Is it flu B? Is it respiratory syncytial virus in real time? And maybe even be able to look at the amount of virus present season over season on average in the population. Would that be a predictor of the effectiveness of the vaccine for that given season? Would we be able to look at season over season variation in average viral load values to be able to predict severity of the flu season?
See, this is fascinating because it's a big data play at the small level, taking that data and feeding in it. Google's try to use symptom stuff to predict, but we could do it very accurately and precisely.
Yeah. What Google Flu really needed was the goo. They needed someone to put the goo into Google Flu, which was the snot, the stuff that you test,
sample.
The actual result for influenza. That would be a lot better at predicting the accuracy of predicting the severity of the flu season. So I think that's where the technology needs to go. It'd be nice to know that, hey, listen, we've got flu cases coming up. I need to stock up on Tamiflu, and I need to order more flu tests, and to know in advance before it actually hits the fan.
Now, before your work with Cepheid, you actually worked a little bit on vaccines and adjuvants and things like that. Do you yourself get the flu shot? Are you a believer?
I absolutely am. I get it every year. And we depend as a population on something called herd immunity to be able to get enough people vaccinated. Not everybody's going to get the vaccine, but if you get enough people vaccinated, you can actually block the effectiveness of transmission of an epidemic, because the infection will run into somebody who's been vaccinated. Will be a dead end there, and the kinetics of spread of the infection are affected by how many people are already immune. So it's important to develop that herd immunity. That can happen through natural infection,
right?
But it can also happen through vaccination. And the combination of natural infection and vaccination to provide a boost to your already existing natural immunity is very important.
Seems to me that your technology, this technology of rapid flu testing, molecular testing, could actually start to analyze vaccine patterns of efficacy and lack of efficacy. So you've got a vaccinated population, some of them are infected, they end up getting actual flu.
Yeah.
You do the actual flu and you figure out exactly what it is.
Yeah.
And what, maybe even can you do flu viral load?
Yes, that's the idea. I don't think a viral load value in an individual patient is that useful.
Right.
But I think if you take tens of thousands of patients and you look at average values and you categorize them by age and vaccine status, gee, wouldn't that be nice? If you saw that vaccinated people had lower viral loads on average, even if they got infected despite the vaccine, had lower viral loads than non-vaccinated, you might be able to say, hey, that's a good match, for this year.
Got it.
If you see 0 Delta, that's maybe a bad sign, maybe something new, maybe an avian flu strain is now appearing. So if there's no protective effect of the vaccine, would that be a way of monitoring the effectiveness of a vaccine, also predicting the severity of the flu season?
And last thought relating to that, there are a group of vaccine folks and even people who believe in vaccines in general who don't like the flu shot because they swear they get the flu shot and they get the flu a day after or a week after.
Right.
I imagine you could actually do the molecular test on them very quickly and say, well, yeah, actually you did get the flu because it was a day after and it takes 2 weeks for the antibodies from the flu shot.
Exactly.
Or no, what you have is not flu.
Yep.
What you have is something else, adenovirus, rhinovirus.
Yep.
And so we could actually put some of this nonsense to rest with actual science.
That's right.
So this to me is very exciting. I'm also excited that you're a fan of flu shot. Having worked on vaccines, having worked on science, you actually understand how this stuff works. And also have the human element of we're trying to save lives here. This is a deadly disease in cases.
Yeah.
And you mentioned natural immunity as potentially being a block in a kind of a herd immunity in itself. So in other words, naturally getting the disease. But in the case of say varicella chickenpox, people want to throw chickenpox parties. Guys, they don't remember. There was something like, I forget what it was, 10,000 admissions a year for chickenpox related complications, skin infections, sepsis, pneumonia.
We don't remember polio as a population, as a generation. We don't remember the impact of polio. We don't remember the impact of measles. We're now starting to see some of that in Europe where they're seeing outbreaks of measles because of loss of vaccine uptake. In places, ironically, in the Congo right now, in an Ebola endemic area, in the context of dealing with Ebola, they're also dealing with polio-like viral infections, measles, monkeypox, and other infections for which there are no vaccines available in that population. And those are confounders. Somebody gets a fever, is it Ebola? Maybe it's measles. So this needs to be sorted out. But the bottom line is that if you actually see the impact of these infections and the significant morbidity and mortality they can produce, if we can go back and revisit history on polio and how many young people were whose lives were destroyed as a function of polio in the 1920s, 30s, and even 40s. Look at the FDR story, right? I mean, this was a big deal, and we've lost that generational memory of the impact of these huge problems. And I think we need to understand that better and realize that, in fact, there are a lot of benefits to doing what we're doing with the current vaccine approaches. And my former thesis advisor, Don Ganem, said, you always have to ask yourself, is the juice worth the squeeze? Is the juice worth the squeeze? And I think in the case of many of the vaccines that are available now, the juice is definitely worth the squeeze.
I love it. I love it. And hopefully we don't get that generational memory back through outbreaks of measles and, heaven forbid, polio, something terrible like that.
Exactly.
Simple answer is, guys, go out and get your vaccinations on time. Flu vaccination is very important. It's still not too late this season to do it. And you're not just protecting yourself, you're protecting your community and those who cannot get the flu shot, the very young, the very old, those with immune system compromised. Dr. Dave Persing, as usual, it's been an honor and a pleasure to learn from people who are actually on the ground doing this stuff, the science and the action of the science on human beings. Thank you so much for being back with us.
It's my pleasure. Thank you.